You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast, and I am absolutely delighted to introduce my next guest. We actually worked together many years ago at a dental practice, and that was the first time I became impressed by this powerful woman. And back then, I was just so amazed at her level of communication and patient connection and engagement that she achieved. But now her career has taken her into a bit of a different direction. I'd like to welcome Dr. Anikó Ball of Optimum Dental Posture. Welcome, Anikó.
Oh, well, thank you. And it's just so lovely to connect with you again. And I love the time we worked together. I also felt a beautiful connection with you.
It was such an impressive thing. You know, I've worked with so many dental practitioners over my decades in dental, and there's been two that have really stand out in my mind as magnificent communicators. One was Dr. Leah Pagonis, who I used to work with at Pinewood Dental Group many years ago, back in my early 20s. And the second one was you. The level of communication and, as I say, engagement that you developed with patients, it was something to sit back and just learn from. So I thank you for your contribution to my early career.
Oh, well, thank you. I always considered my patients as guests in my home. And also, I was fortunate enough to do a lot of training in communication and indirect communication as well. So all of that combined to that ability. And I never stop working on it. To this day, I work on it.
We never get perfect, do we?
No. And I've actually learned I was a perfectionist and I still tend to be. However, I've now learned to just keep on working on effectiveness, but not be a perfectionist, because I realized that I got to be hard on myself and I was whipping myself constantly for not being perfect at anything and everything. So there's a fine line, which I'm sure you know what I mean.
Yeah, it's interesting. It reminds me of what husband Charles Covest talks about in his work, that with everything there are equal number of benefits and drawbacks. And with being a perfectionist, there's wonderful benefits that perfectionists love achieving. You know, things get done very well. There is a standard maintained, but there are the drawbacks as well, aren't there?
Yes.
The pressures on self. So, Anikó, before we move into Optimum Dental Posture, tell us a little bit about why you became a dentist and your journey throughout your dentistry and how it evolved into concentrating on the posture of practitioners.
Well, that's a very interesting question. So I was going to be a doctor because my father died when I was 6 years old in Hungary, and I was told and got to believe that modern medicine could have saved him. But back then, as a 6-year-old, I decided that had I been a doctor, I could have saved him. So for many years, after coming to Australia at age 14, I planned to be a doctor purely to save other little girls' fathers. And then when it came to the last year at school, I realized that it would take a lot longer to be able to be independent as a doctor as against training for 5 years at university and then being able to practice as a dentist. And it was a practical decision. I actually had the marks to get into the medical school, but I chose something more practical so that I could work part-time when I had a child. And also it meant that my mother, who I came with from Hungary, didn't have to work for so long just to support me. So it was a practical decision. And of course, I was a perfectionist, so it was a perfect choice. And I was already in pain. Neck, back pain was already present as a dental student. And then I had my own practice, and chronic back, neck, shoulder pain added to it continued. And I loved practicing dentistry. I then became general dentistry. Then I became very involved in non-surgical periodontics and also indirect hypnosis, conversational hypnosis, to further relax and make my patients comfortable. And then I became very interested in dental sleep medicine. So these were many different areas that I practiced in, and I continued to be in pain for all that time. I visited every doctor, specialist, physical therapist that you can possibly imagine over 30 odd years. And all I got was short-term relief.
Mm.
And I was
it's a trouble because, when I was contemplating this conversation prior to us jumping online together, I asked myself the question, what would my life look like if I was in pain every single day? And I couldn't avoid it because that's how I made money and made my, that was part of my life. And the psychological impact is there as well, and the social impact is there as well as the pain side of it, because you are constantly trying to function with this depletion of energy and this tolerance of kind of a low level pain going all the way through. It would affect your mood, it would affect your team morale, it would affect and your interactions with patients, it would affect everything. It's not just the pain, is it?
No, it's not just the pain. I realized later on when I became well that I had lost my sense of humor. I was really depressed at times and very anxious. I thought, I felt like 100-year-old woman when I was a long way from 100. And I thought, how on earth am I going to manage? And I remember having to wear slip-on shoes because I couldn't get the shoelaces. So I felt quite disabled.
Yeah. And so what was the thing that triggered you into searching beyond the kind of the normal therapies that you were going through to relieve the pain that wasn't actually kind of getting it to a solution? What was the thing that changed things for you?
There was a pivotal moment, Julie, when I had I'd reached the end of my search, and the last very highly recommended physical therapist, who was a specialist in chronic pain, looked at me, shook his head, and said that I was a hopeless case.
Wow.
And I remember getting to my car and just sobbing. I thought, this is the end. What can I do with my life? And then I actually prayed for help. I wasn't into praying at the time, but I prayed for help. I believed that there had to be something out there that could help me. And then, can you believe, 3 days later, I was in a bookshop on my way to a birthday dinner, and I was early, and the book landed in my hand. And the book talked about the fact that if you're in pain, and it actually described in the introduction the fact that I was standing and in pain, then the introduction said, you're probably standing with locked knees. So I looked down, and sure enough, I had locked knees. And then I thought I'd better buy this book. And it was written by a teacher of the Alexander technique. And I read it, and it was the only book, by the way, in the bookstore, because I called and wanted to order more for colleagues. The book itself didn't really tell me a lot, but I just had a very strong feeling that there's something in this. And then it turned out that a day later, one of my long-term periodontal patients had just graduated as a teacher of the Alexander technique. And I had lessons with him within a week. I started doing some work with him. What's interesting, Julie, is that the Alexander technique has been around for over 100 years. However, it's not known outside the performing arts world. And that's because it's usually taught in a very waffly, airy-fairy way. And that's how this patient of mine was also trying to teach me. And I had no idea what he was talking about. But something inside me felt a bit better. And I thought, and that's the reason why it's just not known. And something in me said, I need to explore this. And it's beyond me how I could have done that, because for years that I looked into it, I didn't find the very practical approach that I've now created. And I never had any plans to do the training. It's a 1,600-hour in-person training, which I ended up doing over 4 years part-time. And what happened, Julian, was really interesting. I was just on the verge of continuing, and I'd been doing some laser training for perio, and I was about to embark on some very extensive training in New Zealand. And as I was about to fill out the form to register something, and in a little inner voice said, "Don't." And I was very surprised because this is something I'd been wanting to do. There was a huge passion of mine. And then I listened to this inner voice and I was guided to do the training. And the training itself was really designed for teaching the performing arts world. So it became clear to me that I need to translate the inner ergonomic principles of the Alexander technique, which is literally a user guide for posture and movement patterns in whatever you do, is just not clear. And I needed to translate that into dental industry specific application. And I spent 1,000 hours at least to do that.
That is amazing. It's amazing too that, and who knows what makes us listen to the inner voice. I think sometimes we don't even hear the inner voice. Life is so busy. We're wrapped up in all the things and constant distraction, so we don't hear the inner voice. Sometimes people do hear the inner voice and discard it and don't see it as important. But for whatever reason, maybe that chronic pain that you've been experiencing over a period of time, that desperation for something helpful that made you far more in tune with that inner voice and actually have faith in that moving forward. We can't question the journey, can we, no matter how painful it gets?
No, we can't question it. And it became clear to me that whatever I was going to learn, I would then contribute it to my colleagues, because having suffered for so long, and it absolutely poisoned the quality of my life frequently, I didn't want others to suffer the way I did, especially once I knew that it was something that could be prevented. It didn't have to be the price we pay for being in dentistry.
And I think that's key. I think there is a level of acceptance. This is just the way things are because of the work that I do, but it doesn't need to be that way. You know, with the work that Amina and I do within Dental Business Mastery, we're starting to deepen the level of work that we do with dental teams. We really want to try to change this profession around to be a profession where dental auxiliary positions are filled with people that just want to work in the dental industry because it's so enormously satisfying. And one of the reasons why that's not happening is because there's a small percentage of practices out there that don't have a fantastic working environment. And so I think that's sometimes the perception of the whole industry. But when we're thinking about, you know, we've got the go-to place that I have is the leaders of those dental organizations, those dental practices where it's, you know, I pay you a wage, therefore you just have to do what I do and you should be happy that you've got a job, this mentality. Mm-hmm. I think, that's because it's just an old-fashioned mindset to have, and that's just bleeding in from generation to generation. But when we look at the additional stress factors that are involved in owning and running a dental practice when you're the practitioner themselves, you've also got all the pressures around patient care, but also the physical toll it's taking on you and therefore the emotional toll it's taking on you, then maybe this sort of work is going to help alleviate a lot of the stress and pressures from dental practitioners. And so they are just happier human beings moving through their life. And you were mentioning that, you know, you'd lost your sense of humor. I wonder how much of that's actually pretty prevalent in the industry.
Oh, very much so. And what I'm sure you know is that you cannot separate physical pain and stress. Mind, body is one, and that someone can have the greatest work posture, and then Mrs. Smith, who is a very difficult patient and the temporary crown has just fallen out for the umpteenth time, there is this crunch in your stomach. That's when all the adrenaline is released, and then all the skeletal muscles are contracted, and then vice versa. If people are twisted and bent over patients, they are in pain. The patient is very anxious, fearful, all of that is an interplay, and we can't separate it. And in fact, what I do these days is I combine both. Mostly I spend my time training dental teams. I often train the whole team on how to look after themselves from a postural perspective, but also how to take care of their own stresses, which is time pressure, difficult task, and also patient anxiety, because it's almost infectious.
It really is. And when you explain it in that way, this is part of the success of a dental practice. I mean, we've got three main parts that need to be successful. We've got the business operations that need to be successful, the team have to be successful, and the patient experience has to be a successful one as well. And this is one of the many industries or professions where if we do not provide a quality enough experience for those patients that includes friendly professionalism, helping them calm down, alleviate anxiety, etc., then we just won't be successful. And it's the people that do that. It's the way we deliver that experience that helps that patient see that is successful or not. And I'm just thinking about, I'd like to reframe things sometimes to understand things better. And I'm picturing at the moment a family unit, mum and dad and 3 kids, and everyone is responding to stress differently and in a negative, unhelpful way. They are biting at each other and frustrated with each other. And as you say, their physical management is not optimal. Gosh, the outcome is always going to be bad for any visitor coming into that family unit. And it does tie in perfectly. We do need to make sure that we're looking after ourselves from a posture perspective and a physical perspective. But the mindset stuff has to be there as well, because our mind, more and more studies are indicating how it's the mind that has the supreme control over whether we suffer illness or not.
Oh, absolutely. I often talk about the fact that we've got a little pharmacy shop in the back of the brainstem, and depending on what we think and how we feel, either endorphins, the relaxing, happy, feel-good hormones, are released, which flood every cell in the body and have a positive impact on your immune system and every aspect of your being. Or we have a massive release of stress hormones, which then do the opposite and, incapacitate or reduce the functioning of the immune system, our ability to think. It affects everything. So it's either one or the other. And one of the really big intentions that I have for my life and teaching others that I end up teaching is to be mindful of what you're thinking, how you're feeling, what you're doing, and how you're doing whatever you're doing. Because we need to have, I say, you've got to have an inner smoke alarm, because you can't put out the fire unless you know there is a fire about or something is smoking. So we need to, I call it extreme self-care.
Oh, I like that. Extreme self-care. That's very, very good. And you're right about the smoke alarm, because I heard this, I can't remember who told me this, but I thought it was just magnificent in terms of health and what we tend to do to manage our health as a general norm in Western culture. That if you had a car and your car engine light started to flash red and you took it to the mechanic and the mechanic said to you, well, I can stop the flashing. I can just disconnect the wire that connects the flashing bulb. Will that be good enough? In essence, just putting a Band-Aid over it, not actually getting to the core problem, what's going on with the engine that's making that happen. And it's like I say, yeah, that'd be great, because it's the flashing that's annoying me. It's the symptom that's annoying me. So just cover the symptom up, it's fine. But to actually we don't do that. We want to go to the mechanic and say, no. What is going wrong with my engine that's making this happen? That's what has to be fixed. And for our health, we've kind of stepped away from that as a general rule. But we need to get back to that whole, what is the core problem going on? And our body gives us smoke alarms. It gives us little alerts, little flashing lights as there's a problem here. Now it's time to go searching on what's actually going on there.
I love that metaphor. I use metaphors all the time, and that was my training in conversational hypnosis. And that is perfect, because unfortunately what I've found in my own case and everybody else I come across is that for occupational chronic pain, all the treatment and remedies that are offered are symptom-oriented, not cause-oriented. And I often say to dentists, imagine if you kept on prescribing antibiotics for an apical abscess instead of doing the endodontic treatment. Well, we'd never dream of doing that. And yet, it's always about symptoms. And I want to tell you that quite often I get, in fact, recently, just last week, I had 2 young dentists who contacted me that they have been seeing everyone under the sun like I had, and chronic pain, didn't know what they could do. And one of them was about to leave clinical dentistry.
And they were young.
Very young,
Gosh.
some of them barely out of dental school. In fact, most of the people who I train are very young. When I first started training dentists and dental teams in Optimum dental posture programs, I expected my generation to be in my courses. Well, it's mostly very young dentists. They
And
are
is
in
that because the older ones have just kind of accepted it and they've become tolerant of that level of discomfort, do you think?
Well, it's a combination of things, Julie, and it's worth talking about it because whenever I talk about this, people are shocked. So what I think has happened is this. My generation, and I'm not 25, didn't grow up bending over mobile phones. And the way that people bend over mobile phones is not the way the body was designed to bend. And also they tend to be a lot more active and play sport. I find that the younger generation, of course, even before they entered dental school, they were already doing terrible damage to their spine. They tend to bend around C6, C7, and that's a joint that's not designed for prolonged bending. And also, it's now a requirement to wear magnification loupes in dental schools. And what happens, Julie, is that companies march in, offer massive discount. They don't measure up the students properly. They hold their cast up here, which is not where the patient is. And also the loupes do not have sufficient declination angle. They don't know that you can't sit with regular loupes, the non-refractive loupes. You can't sit up straight and bend your cervical spine to see the patient. So they don't know any of that. So that's the reason I think why young dentists are in more trouble than the older generation.
That makes a lot of sense. It makes a lot of sense. And it's interesting, we've got to be very aware that the solution in inverted commas, and for anyone listening, that's the lovely Daisy. We love Daisy. She's very sweet. But when companies come in and the solution itself is actually exacerbating the problem rather than providing a proper solution.
Yes, well, I have actually trained a couple of dental companies that provide loupes so that when they distribute their loupes, they can actually educate dentists on how to sit with them because that's missing. And of course, what we should be expecting in dental schools or any place of training for dental professionals, including dental nurses, is to be trained in what I call the dental work posture user guide. Everything we buy these days comes with a user guide, but we don't learn how to look after ourselves. My most important message and motto is take care of yourself. You are your most precious instrument. However, unless you have been taught, and no one that I've ever come across has been taught what to do and not to do with the spine, like how to bend over patients without or minimizing the risk of damaging the spine, and what to do and not to do with shoulders, arms, and wrists, then we can't take care of ourselves.
That's it. The cost is enormous, really. You run the risk of losing your career. I mean, you have to go and find something else to do, but losing your health as well. And when you're young and robust, we do have this wonderful assumption that, I'm going to be healthy forever. But then, really do look at people who have, sports people are a classic. They bang their bodies up as elite athletes and then they can't walk properly when they're 60, 70, 80 because of all the arthritis and everything. But put yourself in that mindset of what that would be like, that your body is the thing that's preventing you from being able to truly enjoy all the things you want to enjoy in life and find ease in simple things like walking up a flight of stairs. And I think about my husband, Charles Coves, and that's one of our links as well. He's Hungarian as well, and you know Charles. But he has been doing marathons for, 30 to 40 years. He exercises every single day, and he's got so many important things and so much important work that he does every day. The most important thing at all times is that exercise. He will drop anything to make sure he exercises every day. As a result, he's 72. He'll outrun, outcycle, outswim most people. And he is able to have this continual full life because his body is not stopping him from doing it. And when you think of the cost to damaging the body in the here and now, there are immediate short-term costs, discomfort, social interactions are compromised because you're cranky and you're trying to tolerate all this pain, all the things, possibly moving into anxiety, depression, other more mental health side of things, possibly having to shift your career. But projecting, future pacing ourselves, it's not a pretty picture if we don't start looking after things, because if we are coming from that just stop the flashing red light on my engine in my car perspective, you are not solving any of the core problems. And so there is a stacking of dysfunction. And then you get to a point possibly where it does become a little bit too late. For these two younger people that you were working with, these two younger practitioners, what does their future look like? With your help, I imagine they'll be able to stay in the industry that they studied for and love, and in the long term, because they'll learn how to treat their physical body, but also their mindset a bit as well.
Oh, very much so. They're actually participating in a Brisbane workshop. I run a 2-day workshop where people are immersed in Optimum dental work postures and learn about how to look after themselves from the inside, learning what your body was designed to do and not to do, and then practicing that in daily life and also around dental equipment, because whatever we do that is harmful. So I don't ever use the term bad posture or wrong posture. I talk about harmful or not harmful work posture or postural habits. And anything that we do in the clinic that is harmful, and by harmful I mean we actually have a consequence in our wellness and muscles and joints, we also do some version of it away from the clinic. So I train people one-on-one in dental practices and also in workshops. And the 2-day workshop is a brilliant immersion in all of that. And I train them how to be mindful, because you need to be aware of what you're doing, how you do what you do, because we tend to be on automatic pilot. It's almost, I often think of myself, until I learned to be mindful and learned how to work with my body's design. There's a biomechanical design to our bodies and body-mind. And until then, it was almost like I was a pair of eyes, a brain, and a pair of hands. And the rest was just a black hole, a vacuum. And that's really how dental graduates come out of dental schools. And then we're under time pressure. So once people learn how to understand all this and then practice it, and of course the biggest hurdle to overcome is habit change, because once you learn, it's this thing. For example, I had severe shoulder pain, burning shoulder, and of course my shoulder and elbow was up here, and all the treatment I got was massaging my shoulder, and then the next day I'd be back there. No one actually said, Anikó, how do you drive this body? Well, I was driving myself in the wrong gear. I use a lot of car metaphors. And now learning how not to do that and understanding is one thing, but then, as I'm sure you know, we only have to do something a few times in order for that to become a neuromuscular firing pattern. It's like software in the brain. That's how we do it. Like we look at the mobile phone taking the head down. Well, then after doing it a few times, every time we want to look at the mobile phone, we automatically do that. So as soon as we think of the phone, for example, we're already doing it because there's an automatic firing. And so the greatest challenge that I need to support people in is how to break that pattern and install and improve software. On a computer, you just press delete
Yeah.
of any software you don't
Nice
want.
and
It's not
easy.
so simple. Yes. So I expect, so I asked this dentist who was going to, on the verge of leaving clinical dentistry, young, and he loved dentistry. He was just in too much pain, and he got that no one could help him. And as soon as I looked at his photos, and I often say to dentists I've never met who write to me, or I might see posting on Facebook in dental groups, send me a few photos. In 2 seconds, I can see why they're in pain. And then I tell them you can learn to do it different. So I expect them to have a very different future.
Oh, that is very encouraging. And so what was your healing like? How quickly, when you started to adapt the Alexander technique to a way that was going to be very relevant to you and your work, what was your healing journey? What did that look like?
Well, mine was slower than what what the dentists or dental team that I train have, because no one was explained to me really clearly that, for example, your head sits on top of the spine at this height, and I like to point that out to your listeners. And I had a mirror. Yes, here it is. So I teach functional anatomy, even though all dentists do a year of anatomy, and I got first class honors in anatomy. We don't know where the joint is, important joint on ourselves. And wherever we think a joint is, we move according to that. And research has shown that when we have a faulty picture, it's called a body map. Wherever that picture is in our mind, we move according to that. So we often move in a way that's very damaging. And these body maps form when we play with Barbie dolls, toy soldiers, and teddy bears, so they're not accurate. So the first thing I do is update body maps. And when dentists learn, or anyone that I train learns, that that's where the head sits on top of the spine. Imaginary rod between the ears is the axis of rotation.
Yeah.
And then they know that they can look down here, and there's only 10-degree freedom to look down. If you
Yeah.
look further down, you're using other joints, which are
Yes.
not designed for that.
Yeah.
That begins to change things. So I teach how, in a very practical way, where important joints are, which muscles, not necessarily focusing on Latin names, but some joints are designed for prolonged bending, while others are not. So most of the spine isn't, the intervertebral joints. And also some muscles are not designed for prolonged contraction. Well, unbeknown to me prior to learning all this, all the muscles that move the arm, shoulder are movement muscles. And so if we do this for ages, like all day, well, of course we're going to be in pain. Now, no one taught me like that. And no one actually took me to a dental chair and applied all that to practical in dental industry specific application. So mine took longer because I had to figure out how this applies to me, and it just wasn't clear. And if you're a practical person, and all dental people are practical people, we can't learn the very free-form, almost bohemian fashion that performing artists, actors, singers do.
Yeah,
So
it's a
that
different
was
mindset, isn't it?
different
They approach
mindset.
life with. Yeah.
Yeah. And their training can be very loose and very kind of just feel the air moving against your skin kind of thing. And they love the Alexander work. And there are music academies in the world that employ Alexander teachers on faculty because it changes the way people sing, the vocal cords, their movements. However, that's never going to cut it in our world. So that's why it was more difficult for me, but I was so motivated, and I'm surprised that I didn't drop out, because for ages it didn't make sense to me until it did.
Yeah, yeah. You had the perseverance for some reason.
Yes.
Yeah. And so if there are people out there that say, yes, I live with pain every single day, I take my holidays and it's more recovery rather than recreation because I just have to heal this body so I can get back into that swing of things again when I get back. what sort of results are you getting with all the people that you've worked with? Because you've been doing this for a number of years now. You've worked with a lot of people.
Yes, I had. And what happens is that just from learning what they're not supposed to do and how to do it different, and also I teach everyone how to do what's called the active rest, where they can just lie down in a supported way and allow the spinal disc to literally plump up and decompress, because all day long gravity is acting on us, plus we often assume postures that are not what our body was designed to do. And that's a restorative procedure. By the way, for any listeners, if they go to the homepage of Optimum Dental Posture and scroll to what is active rest and click on it, they will get a free download of how to do it, what to do, diagrams. And although I prefer to show it to people, I've had a number of people who I've never taught myself, but they just read it, and it helped them enormously with back, neck, shoulder pain. So I teach that restorative procedure. What I love to do most, Julie, is when I come into a practice and I train the whole team, because a team that trains together can really support one another in habit change. So when in the lunchroom, for example, people start looking at their mobile phones and they have permission, because you have to give permission to be coached. And during my courses, I ask for permission, and then in all the breaks, I'm forever doing this to people, and people go, dentists usually go, "Oh, I'm sorry, Anikó, sorry." And I say, "You don't need to be sorry. That's not you doing it. That's the habit, the software in the brain doing it. So you need reminders to change the habit." And so a team can help each other. Also, when I have the opportunity to train a dentist and a dental assistant to work together, and I teach them what to look for and work out signals, obviously not in the middle of giving a local anesthetic, but other times, just wave when the shoulder goes up, or when instead of moving the stool into another position, but a lot of dentists are stuck in 12 o'clock position and then do this. Then the assistant kind of reminds them, because whatever you've been doing feels so natural and normal and familiar that you don't even know you're doing it yet again. So, and it's a team building opportunity as well.
And I love that permission to be coached. My first exposure to giving permission to be coached was actually at the practice that we worked at together. And Meg, the receptionist there, I didn't realize at the time, but I was a control freak micromanager. And when I left there, I was then micromanaged myself, and I realized what I'd been doing. And so when I came back into that environment, wonderfully, she was happy for us to work together again as long as I got over my issues. And she allowed me to, she extended that trust out to me, that I said, you have to tell me when I'm doing it, but I won't make you pay emotionally for that whatsoever. And just that verbalization of saying to that person, I agree that I would like to receive coaching from you in this way, and so I've stated that it's okay. Just stating it's okay is all that you need to do. And it's like you release all the barriers and the resistance you have around being told that you're doing the thing wrong again. And so I think that supported coaching space is just so important in so many different areas, this one being one of them. But as you're explaining that in the surgery situation with the dental assistant as well, the way those two people physically treat that patient, it can either be helpful or unhelpful, even as a dynamic of two.
Very much. And of course, I train the dentist to assist the dental assistant, because they get into some terrible positions. And I remember the first time that I trained a team in the beginning, and I had no idea how powerful it is to train the team. And what happened was that the dental nurses, because I break them up into groups. I have assistant trainers coming in with me who are trained by me to assist me. And then in a separate room, often the dental assistants talk about the struggles they have, and they think that the dentist is intentionally blocking their view. And of course, they don't get to hear that the dentist is in so much pain and can't see. And then we talked about it. I get them together, and then with my assistant trainer, guiding the dental assistant. I'm behind the dentist, and we go through all the different challenging situations, and each side hearing the struggles of the other was very interesting, and it made a huge difference afterwards to the practice. And also, dental assistants often say to me this is the first time that they are included in some kind of training, and when they're given the very important task of coaching the dentist into with habit change and to improve the work postures, they feel valued. They're given something that requires responsibility. So it has massive ramifications that I never expected.
Yeah, there's a inner need for all of us to have that sense of relevance with whatever we do, sense of relevance in society, in our family unit, in our intimate partner, but also in our working environments as well. And we do have such an enormous impact on each other. And I think we can really see the impact that one person has on each other is when you've got a fantastic team and then all of a sudden one team member is introduced or becomes bad attitude and they start this, either gossiping or backbiting or whatever the thing is. And you think, gosh, everything was so great and stable before. This one person changes or we introduce this one negative force and look, it's impacting everything. And then that one thing leaves and you're like, oh, we're back to normal again. And so we can't minimize the impact that we have on each other. And to, again, coming back to that work that Amin and I are doing more now than ever, because it's just so important, is to have each team member be fully aware of the impact that they can have on each other and on patients and on the profession as a whole and the community as a whole. And therefore, what does it look like when we are being very helpful in that space, and what are the benefits that we as human beings get from that? Because we are tapping into kind of, maybe for the want of a better word, we're tapping into a more spiritual connection of how we interact with each other and the impact that we have with each other.
I agree completely. And I've seen that situation over and over when one person came in. Yes.
So when you go into a working environment, you've said that you can go in as a workshop, people can contact you and get one-on-one assistance as well. Can they tell us a little bit more what it looks like when people are out there think we definitely need Anikó's work, either for myself personally or for the team as a whole? What does that journey look like?
Well, I haven't been able to offer enough one-on-one training, and the reason is that I haven't had a dental studio where I could do that. I used to go into dental showrooms where I run workshops, and at times I was able to bring in dentists and do some one-on-one training, but it's always difficult to get that the permission from dental showrooms to be able to do that, although they're quite happy for me to run these 2-day workshops. So what and I've been wanting to set up my own dental studio for many years. However, I always needed a dental chair. And as you know, the dental chair is huge and expensive. And so that was the main barrier. And then last year I came across at a New Zealand conference where I was invited to run workshops and give talks, a Swiss-made mobile dental chair. I don't know if you've seen them. They fold up and you can pull it on wheels.
Wow.
I can lift it up. It's amazing. And it's made for practitioners who go into old people's homes or various places. So they do mobile dentistry. And I had no idea that it's a proper dental chair, but it's light and it's not so terribly expensive. And then while I was thinking about it, I thought, oh, this is a good idea. And I borrowed it to demonstrate. A month later, I was in Adelaide at a Dental Hygienist Association symposium, and the same chair came my way. And I thought, there's something in this. The universe is telling me, so I got one. And I'm in the process of setting up in the building where I live. There is a space where I'm setting it all up. It's not quite ready yet, but then I will be able to offer the kind of one-on-one courses that I've always wanted to offer.
That is terrific. And it's in the same building as you as well. How wonderful. It's all coming together.
I know, I'm so excited. So that's in Melbourne. And of course, people can come down and if they are from out of town, I can do an intensive training with them or space it out. So I'll be offering a variety of ways that people can train one-on-one or even in a small group. What I have found, interestingly enough, Julie, is that when I train a small group, and I always keep it small because I want to give everyone lots of individual experiential training, people learn faster than just one-on-one, even though one-on-one is important following up the initial training, because we can't see ourselves, but we can see it on others.
Nice.
And so when I train a small group, I'm always training the person that I'm directly working with. And I do what's called kinesthetic guidance, where I might have my hands on someone's shoulder and just gently suggest the idea that the shoulders don't have to be up. It's not a manipulation. It's called directional thinking, but I actually give them an experience of it. But I'm also training the group because they are watching and they seem to learn somewhat faster. So my ideal way of teaching is in a group. And of course, I love to follow that up with individual training because that helps to break the habits, the harmful habits.
Yes.
However, go on.
No, I'm loving that space that you're taking my mind to, that because quite often we can think, oh, we really need to do one-on-one to be able to train people. And I know through the work that I do that role plays is just so extraordinary, even more powerfully than when you're the observer. And I get more ideas coming forward from the observers. Oh, that sounded good. Or no, I reckon change the way we say that. And it is from that observation role. That's how we learn as children, isn't it? We just watch our parents and people around us, and that's how we learn to walk and talk and behave and all the things and eat. And
absolutely. I find that the observers learn as much as the person. Now, and I give everyone a turn to be observer and also to be the person that I'm directly training and guiding. So I call it kinesthetic guidance. But definitely there's something very valuable when people see others doing the thing that they're doing, which they don't see. I also take photos and show people or get people to send me photos. And what often happens is that even before they send the photos to me, as soon as they look at the photo, for example, the young dentist who was going to give up clinical dentistry because he didn't think anyone could help him, at my request, he got some photos taken. He said as soon as he looked at the photos, he knew that he's doing things with his spine that he shouldn't be doing. Yeah. So it's very valuable to see ourselves, which we don't tend to do.
We don't tend to do. We notice that sort of thing when photos have taken of ourselves. When we're just talking at a party or something, you go, oh my God, I've got a scowl on my face. Do I always walk around like that? Or my shoulders are all slumped. And I still remember there was a practice that I did some work in, and they had a terrific poster on the wall at reception that just the receptionist could see that just showed that the deeper dip that your head goes to, the amount of weight, additional weight that's put on certain parts of your spine as well. So we do, it's not something that we naturally know. And it is something that once we become more aware about it, we think, oh, goodness me, why, of course this is going to be having a detrimental effect on our physical bodies. So your work is so enormously important. They say so much within dentistry more things should be taught, such as, how to run a business and how to do this and how to do that. But really, doing your dental degree, that's step number one, and that's just got everything to do with the teeth and the mouth. But everything else is up to you to make sure that you've got all the information that you need to be able to thrive in your work. And work takes up such an enormous part of our life, especially if we're passionate about it. This is, our life as well that we're talking about. And the lessons that you teach dental team members go far beyond, as you said, the walls of the practice. This is, how we're holding ourselves in general life, everyday life as well.
Oh, very much. In fact, I get people to practice in the kitchen, reaching for cupboards, chopping instead of bending like this, or stirring the pot like this or various things, and coming back to, and of course, one thing that I want to stress is that unless people can become mindful away from the clinic and become aware of harmful habitual posture and movement patterns and change them, there's no way that they can become mindful and make changes in the clinic when they've got time pressure, appointments, anxious patient, complex treatment. So it's becoming mindful and practicing away from the clinic is very important. And coming back to the head, the weight of the head is at least 5 kilos. It can be 4.5 to 5.4 kilos. And I think to be in the dental profession, you've got so much gray matter, probably 6 kilos. I usually carry a 5-kilo weight wherever I go. And I get people to hold it close, and they're shocked that the head could weigh that much.
Yeah.
And I've held it 1,000 times, and I'm still shocked whenever I hold it because we're not aware. Then I get them to hold it away, a little bit away from themselves, from the body. And I ask them, does that feel the same weight? And it always feels heavier.
Heavier.
And the point is that whenever the head is not on top of its support structure, which is over here, but more a forward head posture, then for every 2.5 centimeters of forward posture, the weight, the loading, so it's the same weight, but the loading on the body becomes double, triple, quadruple.
Whew.
And same with if you lift up a parcel or a young child, if you lift it up away from you, you're picking up massively multiple amounts of that weight. And that's when people do damage. So everything should be held very close. And these are the bits of information that people don't know. In fact, if all people learned when I give lots of short presentations is to not bend their head down to the mobile phone. I say, you've got a hinge joint called the elbow, and bring the phone to you rather than the head down. Or I am in favor of having these stands where you don't have to look down to see if you've got a message. And if that's all they took away, that would immediately change their well-being.
Yeah, and they pass those sort of lessons on to their kids as well, and their kids won't have, when you think about some of the breathing difficulties and, asthmatics and all the other things that go along with a child's body, we're exacerbating all of this if we are loading their bodies in a way that is not natural.
Yes. But we don't learn that a lot of what we do is not natural. I thought that I could do anything with my body that my flexibility allowed. Yeah. Well, when you're in movement, that's okay. But when you're holding postures, as we do patient after patient all day long, repeatedly in dentistry, that's when we need to know there are basic road rules. It's just like we wouldn't get out and drive a car without learning road rules and a little bit about the car. We don't have to be mechanical engineers, but you need to know that's the user guide. And same with the body. It's not rocket science, but it's so left field. And I'd love it to be taught in dental schools early on, because the earlier on we can teach how to do it right, the easier it is.
Yeah, that's right. That's right. And those habits of posture in the surgery, at the very least, will be modified in those very early stages as well, but then it will start to impact the rest of their lives as well. It's such an important space. Gosh, this is part of how we, if you expect to be able to thrive as a dental practitioner, we really do need to become more mindful about this space and doing things that are helpful for our posture rather than unhelpful for our posture. If people want to reach out to you, what's their best next step?
I can be contacted through Optimum Dental Posture, the website. Also, people often contact me via Messenger, Anikó. It's so easy to contact me, and I help people. I give them advice about magnification loops, about what is a good dental stool. Many are not, because those two are important. I call that an outer and inner ergonomic interface, the two that I just mentioned. The rest of the time I teach what to do inside, but there are certain, I call everything that's not the person, not the clinician or the dental assistant, is the outer ergonomics. And what you're doing inside your efficiency in posture movement, is inner ergonomics. So I give people advice even if they never ever come to do anything with me, I'm happy to give them advice on Messenger. I talk to them on the phone. I get online. So I can be easily contacted. And of course, the best way to really change things is to have me come out to their practices or for them to come into a workshop that I'm running. And also next year I will have a space, a studio where I can teach a small group up to perhaps 4 and one-on-one. So there'll be a lot of opportunities to train with me.
Oh, I love it. I love it. And all of the ways to connect with you are going to be in the show notes as well. So if anyone's interested, just go straight to the show notes and click on all the links. Anikó, it's been so delightful to reconnect again, but also to learn much more about what you do as well. I keep following your journey all the way through because it is such an important one. And if anybody is interested, definitely reach out. Even information is powerful in this space. And so this is going to be one of the ways that you can make sure that you thrive as a dental team member. So thank you so much, Anikó.
Oh, it's my pleasure. And it's a mutual admiration because I have been following your and Amina's journey, and I love all that you do. So it's wonderful to reconnect again.
Fantastic. Thank you so much. And hopefully you'll come back on the program with new details about your studio once it comes up and running.
I would love that.
Beautiful. Thank you.
Thank you.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.